Hello, welcome to this video. I am actually in our Sandtray room today recording this video because we're going to talk about 4 things to remember if you're doing Sandtray work or Sandtray therapy with neurodivergent children. Just 4 points that maybe just don't come to mind right away, but are very important and are things that we want to remember and think about if we're going to do Sandtray work with neurodivergent children. So let's jump right in. Point number 1, we want to be aware of and we want to consider any sensory differences that the child may have. We know that a lot of neurodivergent children do have sensory issues, needs, differences, and we want to know those for sure when we're working with them in any type of play therapy. In Sandtray therapy, where it's really important is they may really have some struggles with the sand, the texture of the sand that you're using, the type of sand that you're using. Even if you're offering some alternatives, even the alternatives may be things that are very troubling or bothersome to the child in terms of their sensory differences. So you don't want to have them, of course, in the Sandtray room trying to make them do a Sandtray, and this is a very uncomfortable or painful experience for them from a sensory standpoint. Some kids, may be able to tell you this, which is wonderful, or maybe you get this information in the intake from parents. Or maybe, nobody knows yet. And so you really want to be watching for this and see if you discover that this is a sensory sensitivity or a sensory difference for the child. And then, of course, we would not want them to participate in this and it be some kind of unpleasant or painful process for them. So just keep that in mind, that there could be some sensory differences. Go into your Sandtray work with neurodivergent children with that in mind, and to make sure that you check on this and figure this out as much as you can before you attempt to do the Sandtray work. Second thing is allergies. So this could apply to any child. It doesn't have to apply to just neurodivergent kids, but I've worked with a lot of neurodivergent children who do have some actual allergies to different products that are put in commercial sand. And a lot of Sandtray rooms, including ours, is set up with commercial sand products. And so you might not even think about that. You might not even realize that there's a certain product in the sand that someone could have an allergy to, but it is true. It does happen. I've had those clients on my caseload. And so obviously they would not be able to participate in the Sandtray. And again, hopefully this is information you'd find out in the intake. The parents would let you know, or the child would let you know before you discover this, unfortunately. And this can even include ways that you may not think of, like even if you have a miniature, okay, we're not going to use the sand, but let's use the miniatures, right? And there's any sand residue or even just little pieces of sand stuck in your miniature somewhere, on your miniature somewhere, that can really cause the child to break out or have the allergic reaction, just that much. And so we really have to make sure that we pay attention to this. And if this is a real issue for the child, then we might not be using the Sandtray room at all, because there's just sand gets everywhere, right? We may not be using the miniatures at all. And certainly, we may not be using this, we wouldn't be using the Sandtrays. The third thing to consider is possible fine motor issues. There are some kids that I've worked with who do have some fine motor skill issues, and they have a really hard time grasping or hanging on to or clutching the miniatures. So to go back here and get a miniature and pull them off the shelves and put them in the Sandtray, really hard and uncomfortable for them. And again, it just may be something that you don't even really think about until you're in the Sandtray room and you're like, oh gosh, they're really struggling with this. I should have known that. or maybe even knew they had fine motor skills, but it just didn't register that, oh yeah, they won't be able to really navigate grabbing these miniatures. What can happen then is it can become a very frustrating experience for them. It can kind of become dysregulating, that they're struggling in this way, and they're wanting to do something, and they see what they want and they're having a hard time doing it. Now, certainly you can help them, and there's no problems with that. If they need help with their fine motor movement and to grasp miniatures, you can come in and help them with that. But just being aware of this and handling it in a sensitive way, in an affirming way, is really important. So something you really would like to know before you enter the Sandtray therapy activity or process, but certainly if you discover it while you're in there, be prepared to address that, in a supportive and affirming way. And the last point that I think is good to remember, that again, maybe we just don't always think about, is some neurodivergent kids really may not like symbolic play. They may not like symbolism. They may not like pretend play. They just may not like these elements of play. It's not their play preference. It's not the kind of play they want to do or that they're going to do. And so to bring them into a traditional Sandtray therapy process where, it's usually highly full of symbolism and maybe metaphor, even pretend play, they may not do that well. They may not like it. They may not enjoy it. They may not want to do it. And maybe they won't, tell you that, right? Because you're the adult and they're the child, and they may not feel like they can say that. So you also really want to try to understand the child's play preferences before you bring them into the Sandtray experience, at least in the sort of traditional Sandtray therapy way, because it just may not be their type of play, and that's okay. At the same time, let's add in here that just because a child's neurodivergent doesn't mean they won't like Sandtray therapy work. I have a lot of kids on my caseload, autistic, neurodivergent in different ways, that do like the Sandtray work. They love, creating scenes in the Sandtray, and they all tell stories through their Sandtray, and this is a type of play that they like. So it's not automatic one way or the other that a neurodivergent child will dislike this or like this. What is more likely is that it would be a variety. You'll get both experiences. So you just have to be aware of that and remember that if you do kind of more traditional Sandtray therapy work. I guess the last thing I would just add in here, this is a bonus, is we actually have kids who come into the Sandtray room just to play in the sand. They're not interested in miniatures. They're not interested in creating a story or anything like that. They like the sand. It's soothing for them. It's actually a positive sensory experience for some kids. And so they like being in the sand and digging in it and putting their hands in it and just doing sand play in general is something that they're drawn to. So you might have that experience as well. So just a few things to remember about your Sandtray room, Sandtray work, or Sandtray therapy, whatever it comes out to be, any and all of those things when you're working with neurodivergent children. So I hope that helps a little bit, gives you something new to think about. Please like this video if you like it, and subscribe to the AutPlay Therapy YouTube channel, and follow us on Facebook, check out our website, all that good stuff, and come back and watch more videos. Thanks.